Are you wondering what can cause a pregnant woman to have a premature baby? In this video, I will explain the 6 most common conditions that I have seen again and again working in the NICU that causes a mom to deliver early. Stay tuned. Hi there. If we haven't met before, my name is Iman, and on this channel I teach moms and their families all about their high-risk pregnancy and the NICU to decrease fear and increase confidence. No woman ever expects to have complications when they are pregnant. You expect to have a regular pregnancy, go full term, have a regular labor and birth, and eventually bring your baby home. But this is not the case for many moms, including myself. I personally never thought I would have a complication in my pregnancy because I was low risk in everything and my pregnancy was going well and it was easy. But I did have a complication. I actually had one of the 6 conditions that I will be talking about in this video. This condition made me high risk and made me deliver my baby early. Before I start, I just want to make it clear that if you are high risk, it is not a guarantee that you will deliver a premature baby. But the chances of having a premature baby is increased because the condition you have that made you high risk can cause the baby to come early. There are many moms who are high risk in their pregnancy and go full term and have full term baby because they are closely monitored and they receive proper treatment early on in their pregnancy. Also, this is big, so make sure you are listening. There are also many women who have no risk factor who end up having a premature baby and no one knows why. Their doctors have no explanation of why they had that baby early. These premature births are the hardest for doctors and nurses to explain and understand. And to this day, nobody really knows why these women end up going into premature labor. So as I am recording this video in 2021, there are still so much research being done on why premature birth and labor occur. Comment down below if you knew the cause of your premature delivery, or was it unknown? I would love to know. So remember, each of these conditions I'm about to mention need their own videos, which I plan to do. If after watching this video you have questions about your pregnancy, about your baby, make sure you talk with your healthcare team first. That's what they are there for. Okay, let's get started. The first condition is preeclampsia. Preeclampsia is when the blood pressure is very high and it causes damage to other organs and cells. This high blood pressure can lead to seizures and death if not treated. We don't really know why preeclampsia happens, but we know it's connected to the abnormal development of the blood vessels of the placenta early on in pregnancy. Preeclampsia only happens after 20 weeks, which is key. Also, some moms can experience preeclampsia after birth as well. Preeclampsia consists of 3 factors. Number 1, 2 readings of blood pressures equal to or higher than 140/90. Number 2, protein in the urine. This is a sign of kidney damage because normally there should be no protein in the urine. And number 3, damage to the liver and brain. Damage to the liver leads to HELLP syndrome. HELLP syndrome occurs in severe preeclampsia. At this point, the body is trying to repair itself because of the damage that has already happened. Signs and symptoms include high blood pressure, of course, protein in the urine, like I mentioned, swelling. So swelling in the hands, arms, legs, drastic increase in weight gain, trouble breathing, headache, constant headache, vision problem, and abdominal pain. The risk factors for preeclampsia include first pregnancy, multiple pregnancies, for example, twins or triplets, mother is older than 35, having high blood pressure before pregnancy, diabetes, and obesity. It is very important to monitor you if you have preeclampsia, as it can be dangerous for you and your baby. This is why at every doctor's visit, pregnant woman's blood pressure is always taken to catch preeclampsia early. The best treatment for preeclampsia is the delivery of your baby. If the baby is really premature, then the doctors will try to keep the baby in for as long as possible, and they will try to control your symptoms through medication. You will receive steroid shots to help mature your baby's lungs faster in case they have to be delivered early. Until then, you'll be closely monitored and they will give you medication to try to lower your blood pressure. But if the blood pressure is not coming down and your symptoms are not improving and they're actually worsening, then the last resort is to deliver your baby to protect your life and your baby's life. The second condition is cervical insufficiency or incompetent cervix. This problem and condition is not known until you get pregnant and you get further along. Normally, the cervix is closed and it's long until you get to full term. Then it starts to shorten and open up for labor. So cervical insufficiency is when your cervix starts to open up too early in your pregnancy and it shortens in length as well. As the baby gets bigger in the uterus, it will start pushing down on the cervix. Then that starts to cause your cervix to open up prematurely. Cervical insufficiency is seen after 20 weeks and sometimes no signs are present. Signs and symptoms of cervical insufficiency are usually pain or contraction is present, pelvic pressure, light bleeding, mild abdominal cramps. No one really knows why it happens and which pregnant mom is more of a risk than the other. This is why usually most pregnant women get a measuring of their cervix at around the 18-week ultrasound to catch any shortening of the cervix. A shortening cervix is usually caught in ultrasound. The solution for it is usually to put a stitch in, which is called a cerclage, to keep the cervix as closed as possible for as long as possible and to also minimize physical activities. There would be more ultrasound and monitoring to make sure the stitch is in there and is keeping the cervix closed. If doctors are not able to keep the cervix closed, then a preterm delivery is considered. And the third condition is placental insufficiency. And this is what I had. Placenta problems can happen with no explanation, or it could be a side effect to another condition such as preeclampsia. The placenta is the lifeline of the baby. It provides oxygen, nutrition, and everything needed for the baby to grow properly. Placental insufficiency is when the placenta is not providing enough nutrition and oxygen for the baby to grow well. In other words, the placenta is not doing its job and the baby is struggling inside to grow. Signs and symptoms of placental insufficiency or any problems with placenta is baby is measuring small for their age in ultrasound, abnormal blood supply going to the placenta, abnormal blood supply going to the baby and it's seen in ultrasound, decreased movement of the baby during ultrasound or during the non-stress test. Risk factors of this condition is usually the first sign of preeclampsia. And if there's no preeclampsia present, then there's no risk factor. I personally had no risk factors, but they were really monitoring my blood pressure closely, but I didn't have any blood pressure problems and my placenta problem came out of nowhere. The placenta problem and every other condition that I'm going to mention, the doctor and the healthcare team try to keep the baby in for as long as possible and monitor the symptoms frequently. Some moms are hospitalized to be monitored and other moms can go home but have to return for the ultrasound and other tests. Also, a non-stress test is used to monitor the baby's heart rate and movement. I had the NST done twice a day for 2 weeks until my baby boy came. Once the doctors see that the baby is very stressed and not doing well inside, then they consider the option of delivering. These babies are usually IUGR, intrauterine growth restricted, meaning they have stopped growing inside their mom, and once they are born, they are really small for their age. Their weight and size is small, but they usually have a big head. So they have a big head and a small body. And this is because even though the rest of their body stopped growing, their brain was still getting blood supply and growing. The fourth condition is PPROM, preterm premature rupture of membrane. PPROM is when your water breaks before 37 weeks. Your water, which is called the amniotic sac, protects the baby from any bacteria. So once your water breaks, you have an increased chance of getting an infection. Also, without the amniotic sac, preterm labor might start. Signs and symptoms of this condition are most likely see leaking, and it's scary. And also, this happens out of nowhere. Risk factors for PPROM are previous uterine infection, blunt trauma, so that includes a fall or a car accident, stretching of the uterus or the amniotic sac, and this can happen when you have multiple or when you have too much fluid. The most difficult part of PPROM is it usually happens without any explanation or any risk factors present. This is the hardest for a lot of moms to understand and accept, because they don't understand why it happened and if they did something wrong to cause it to happen. The treatment of PPROM is to decrease the chance of infection and to prepare your baby for preterm birth. Like I said, they try to keep the baby in as long as possible, but if the baby needs to come out, it will need to come out for safety. This includes a hospital admission right away to be monitored and to keep the baby in for as long as possible, getting medications like magnesium sulfate to delay labor, getting steroids to mature the baby's lungs, getting antibiotics to decrease the risk of infection. These are broad guidelines, but always talk with your healthcare team if you have any questions about your situation. The fifth condition is a UTI or any other infection. This includes any vaginal infection, any infection in the uterus, the amniotic fluid. Symptoms of a UTI can easily be missed by a lot of pregnant moms because problems with urinating and peeing can seem to be a normal side effect of pregnancy, so it can easily be missed. If signs are missed, then a UTI can cause contraction. Signs and symptoms of a UTI are needing to urinate all the time. When you sit down, no urine comes out, burning and pain with urinate. Treatment is you need to give a urine sample first to check for bacteria. And if the urine sample comes back positive, you will be given antibiotics. And hopefully this will stop contractions. This is why getting treatment early is very important to prevent preterm labor. It's harder to stop contractions if a UTI or another infection is left untreated. If you had received treatment of antibiotic but the contractions have not stopped, then there is something else that might be going on. Your doctor will probably do further testing. The sixth and last condition that I would be talking about is placental abruption or hemorrhage. This is when the placenta starts to detach from the uterus, which can cause lots of bleeding. So the uterus starts to contract to stop the bleeding. Therefore, labor is induced with these contractions. Also, if the placenta detaches from the uterus, it has lost its effectiveness. The baby can be in danger and distress because of loss of oxygen. Signs and symptoms of this condition include hemorrhage. So bleeding can be visible or it can be hidden. Abdominal pain or contractions, decreased baby movement, and a hard abdomen. Risk factors for this condition include having preeclampsia, having uncontrolled high blood pressure throughout your whole pregnancy, trauma to the abdomen, smoking and drug use, and multiple pregnancies. Treatment for placental abruption depends on how far along the pregnancy is, how the baby is doing, and how much bleeding is present. If mom and baby are stable, then blood transfusions can be given to keep them stable. If there is severe bleeding or the baby is not doing well, then an emergency C-section would have to be considered. I listed the most common conditions that I have seen that cause premature birth, but there are many other conditions and causes too. Like I said, there are many moms who have premature babies that have no explanation on why it happened. This is the hardest situation as a healthcare provider to explain, and it's difficult for any NICU parent to accept. But the bright side is most of the conditions I mentioned do have treatments that can be started early in pregnancy, so preterm birth can be avoided. So never give up hope on having a full-term baby after you had a premature baby. Comment down below if you know anybody who's had a full-term baby after having a preterm baby, or wondering what a premature baby is and what kind of challenges they might face in the NICU. Learn all about this and how to help your baby.